Originally, I wanted to be a lawyer. It was my mother that convinced me to go into nursing as a freshman at Tuskegee University. She cared about people. She cared about her work. She took pride in her work. So it was rewarding for career for her. She was able to take care of us growing up, and she thought it would be a great profession for me based on my personality. I was one of those students, I could skim through material and kind of wing it. And so when I got to nursing school, I thought, I've done this my entire high school journey, so I may be able to wing it. But when I was accepted into the School of Nursing at Tuskegee University, and my first semester, I thought that I'd just kind of wing it and read the material the night or two before. It did not work out well. So I got a rude awakening to college and the School of Nursing. It, caused me to have to restructure how I studied, manage my time. Those are also, I think, lifelong skills that I learned early on in my career that have been beneficial. I envisioned myself in a position where I could help people, not just people by the bedside, but help people to find the next step in their health care plan for them. That I knew I would have to take on a leadership role. I was out there, part of the startup team for the medical clinic at the Hyundai plant. And there was a nurse who was employed by Hyundai. And she said to me, you're too young and too smart to not go back to school and become a nurse practitioner. She said, it's the wave of the future and you absolutely should do it. So that was the moment for me that changed my thought process, and I knew I wanted to advance, the practice of nursing. And I enrolled in school, and there were many angels along the way that helped me through that process, that were encouraging, that shared scholarship opportunities, job opportunities, that paved the way for me to become a nurse practitioner. I grew up in what was once a rural town, and I understand the implications of deficits in rural communities. And I think nurse practitioners have done an outstanding job filling many of those voids in rural health, to fill those gaps and create access, most importantly. We are making a difference where otherwise those folks may have to drive 40, 50, 60 miles to seek health care. It was an absolute honor for me to be elected the first Afro-American president of the Nurse Practitioner Alliance of Alabama, to lead nurse practitioners across our state and be advocates not only for our patients, but advocates for advancement of nurse practitioners working to the full scope of practice in our state has just been super rewarding. I've had the opportunity to grow our membership with the NPAA organization and lay some good foundation for possibly future legislative changes that will occur in our state. I want to be in a position, serve in a capacity where I can make a difference not only for the patients of Alabama, but be able to be impactful on the decision-making, legislative laws, the policies that affect our healthcare system. There's a lot of work to be done in the state of Alabama. I want to be a part of that. I want to continue to be in a leadership capacity where I can make that difference.